So we'll just go over cluster 3, assessment task 5. So question 1, the following question provides an overview of the Australian healthcare system and the nurse's role within it. In your description, explain the following. So in total, we want 400 to 600 words, and we want you to incorporate in those 600 words the social, political, economic aspects that affect the overall healthcare system. So we've discussed in class in TUTE social, political, economic. Political can be talking about state and federal political parties, and economic can be as a financial reasons why the healthcare system can be affected. And again, that may be down to state and federal funding of the healthcare system. Then in D, we want you to talk about the structure. So the structure talks about the primary, secondary and tertiary aspects of the healthcare system. And then we want you to, in your own words, talk about the strengths and the weaknesses of all of the above, of all of the strengths and weaknesses of the social, political, economic, and the overall structure of the system. Okay? So, yeah, we want to know what your opinion is with the strengths and weaknesses. Number 2, the current service models and standards of care. So, on a number of times in class, I've referred to the National Quality and Health Standards. So you might want to talk a couple of sentences about what they are. And what services does the Australian healthcare system provide? So just break that into 2 parts. Question 2. Number 3, the different healthcare environments, including non-Western approaches. So basically, we want you to give in 2 or 3 so about 5 different examples. Can you give 5 different examples of non-Western approaches to healthcare? Number 4 is the primary healthcare framework. Okay, so what are the services in the primary healthcare setting? What do we do in the primary healthcare setting? Number 5, the interdisciplinary team, who participates in the planning and management of patients. Number 6, the evolution of nursing. So basically looking at the history of nursing and what are the things throughout the history of nursing that are the same and what are the things that are different. Number 7, this should be fairly easily. It's just describe what the NMBA is and what the ANMF is. Number 8, we want you what the funding sources available. So pretty much we want you to describe how the public system is funded and how the private system is funded. And we just want 2 to 3 sentences to describe both of those. 9, how would you explain to a client their possible healthcare choices, public versus private, regarding hip surgery? So if someone was to have surgery on their hip, what would their experience be if they were a public patient? And what would their experience be if they were a private patient? What are the differences? How would you explain the differences between the 2 of them if they were having hip surgery? Yeah, number 10, given the structure and your understanding of the Australian healthcare system, describe how socio-cultural and other social factors may influence health and illness. How might these factors then influence policy development? So essentially we want you to, so it's broken down in 2 parts. So think about all of the aspects and all of the things that affect someone's experience with the healthcare system and their experiences of health and wellness or illness if they're from different socioeconomic backgrounds or different cultural backgrounds. So how are their experiences different? And then how might those things, those differences, affect policy development, so affect how government decides how money is spent and how the healthcare system is structured and what are the things that they want to do. So policy development is at a government level. What are the state government and the federal government do about these things? 11, briefly describe the basis of the following nursing theories. So these are all nursing theorists. And essentially for each one, we just want you to tell us what their nationality is, the years they were practicing and where they worked, and then just a few dot points, minimum of 2 to 3 dot points about the things they believed, and then how their theory affected nursing practice. Okay, how have they contributed to the development of nursing theory? So what their theory was, and then how it changed nursing practice, or how you think it changed nursing practice. Number 12, how might you incorporate the theoretical framework into your care of an elderly patient with dementia in a primary health environment? Now, what I want you to do here is just concentrate on Dorothea Orem's theory when answering this question. Okay, how does Dorothea Orem's theory, how would you incorporate it into looking after an elderly patient with dementia in a primary care environment? So you really need to know in some of these questions the difference between primary, secondary and tertiary healthcare. Okay, all right, and that's it.